3:30, and let's get started. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. We do not have prepared remarks today, but we are here to answer your questions to the best of our abilities. Some of your questions could be best answered by our healthcare partners, and in those cases, we will redirect you to the health systems. For Friday's call, we have asked many of our partners in the QC COVID-19 Coalition to join us at 3:30 p.m. Zoom meeting information will be sent out Friday. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. We are joined today by Ed Rivers, Director of the Scott County Health Department, and Nita Ludwig, Public Health Administrator in Rock Island County. In Rock Island County, we are announcing our 4th COVID-19 case. This man is in his 60s and is being treated at a local hospital. Ed, would you please update us on the situation in Scott County?
Yes, today the governor announced 4 cases in Scott County. One, an elderly individual, 81 years of age or older, and 3 middle-aged individuals, 41 to 60.
Okay, thank you, Ed. We'll go straight to the chat, so please begin typing your questions in there and we will respond to them as soon as they come through. We'll start with the first one here. Yesterday, in the Iowa Governor's press conference, one of her staff said contact tracing was being done by the county health departments, but suggested it is only being done in certain cases, like the hospitalized cases. Can Ed explain who is contact traced in Scott County and what the criteria is?
As the Public Health Department, the Iowa Department of Public Health has assigned contact tracing to the locals. Our Clinical Services Department does that contact tracing. I do not have the details of that procedure, but perhaps we can get Roma Taylor, our Clinical Services Manager, on a future call to explain that.
Okay. Second question, just to clarify some of the Scott County numbers again. Ed, could you just reiterate that and we'll type it into the chat for the number of cases?
1 elderly individual, that category is 81 plus, and 3 middle-aged individuals, 41 to 60.
The second question is more generally speaking. Nita, maybe you could answer this for us. Please briefly explain contact tracing and how it helps when it comes to communicable diseases.
Sure. So contact tracing is done every day by our infectious disease department on reportable diseases and conditions. When we get a call about a reportable disease, and COVID-19 is a reportable disease now, then the nurse follows up to, basically it's an investigation. It's an investigation into where that person has been, when they got sick, when they got tested, who they may have been in close contact with, is there, a workplace that would need to be contacted, were co-workers in close contact with that individual, family members, extended family, all those sorts of things. It's basically an investigation into where this person has been and who may have been they were infectious.
Thank you, Nita. This is for both counties. Do you have the total number of flu cases that you've seen this season? Ed, would you like to explain how flu takes place?
Well, since influenza is not a reportable disease, we don't have those numbers, but the Iowa Department of Public Health does have an update on its website for influenza-like illnesses that you may wish to peruse. Also, generally speaking, the CDC website has noted that this has been an escalated flu symptom with particularly bad effects among the young population. Children have been more affected this year than in past years.
Nita, do you want to respond to that for how it's reported or not reported specifically in Rock Island County?
Sure. In Illinois, influenza is not a reportable condition unless the person is admitted into an intensive care unit or if there is a flu death. There are sentinel sites in Illinois that they monitor flu activity, but it's generally only reported as moderately spread, widespread, and the like. And that would be listed on the Illinois Department of Public Health website. But we have seen recently a lot of influenza A and B still in Rock Island County. Even now in late March, we are still seeing influenza cases.
Thank you. Next question, how many COVID-19 cases do we have now and or have had so far at QC hospitals?
Well, the cases in Scott County brings our total for Scott County residents to 7. Statuses for these 4 cases announced today were not announced whether they're hospitalized or whether they're isolated at home. You'll remember that we had 2 persons test positive in Scott County who are not Scott County residents.
Do you have anything you want to add to that, Nita?
Sure. In Illinois, we have now a total of 4 positive cases. They are 3 males and 1 female. 2 males are in their 60s, and they are both hospitalized in local hospitals. And 1 male is in his 70s and is also hospitalized. The female in her 40s is on home isolation at this time.
Thank you. Next question, who is tracking the number of ventilators and projected need of them, the health departments or the hospitals? And can you walk us through how this information is fed to the state level for both states? Ed?
Locally, the Emergency Management Agency is at the tip of the spear in resource allocation. Meetings are being had for various aspects of resources in the county, personal protective equipment, ventilators, any other resources that hospitals, emergency medical services providers, and the like may need.
Is there an effort to get college dorms or other buildings ready for overflow or lower level cases? Who is leading that? Nita, do you want to speak to any of the conversations taking place with some of the campuses in the area?
Sure, I can speak a little bit to that. We do have emergency support functions within our emergency management agency, disaster plans, and the like. We have one group that is called Mass Care and Sheltering, and there is a whole group that is kind of looking at those plans. Emergency management is involved in that to look at alternative places if needed. And I do believe, as Janet mentioned earlier, that some of those partners may be on tomorrow's call and could speak a little bit about that, but I do know work is being done on that.
Thank you. Do we know if these latest confirmed cases had traveled recently? Ed?
That information was not announced.
Nita, do you have information on that for Rock Island County?
In general, I can say I think at least 2 of these cases were community spread.
Okay. This next one, could we get someone from EMA on this call one day? And I do believe we have that anticipated for an upcoming call, so please stay tuned for that. Also, there were some local Illinois schools scheduled to go back to school fairly soon. Do you think the schools will extend the closures if they feel the peak has not been reached? Nita?
Sure. For Illinois schools, I believe those conversations are taking place between the Illinois State Board of Education and the Governor's Office and Illinois Department of Public Health. So a level higher than locally, and I don't think they've reached a decision as of yet.
In Iowa, the governor did note on her teleconference today that the recommendation that schools in Iowa be closed until April 13th continues.
Okay, we'll give it another minute. Please feel free to enter any additional questions into the chat. We'll mute for 1 second to see if we receive any additional. We have some additional questions. Scott County got an F grade for social distancing based on phone location data. Our efforts to social distance flattening the curve.
Well, we're not sure about unicast methodology and how granular that information is. If you're just tracking cell phones and how people are moving, we don't know how definitive that is. Plus, Illinois is under a shelter-at-home order, which may have a more acute effect in Rock Island County. Plus, looking at the map, it's not clear whether they took into account that Rock Island County only has a small piece of I-80, which is one of the most traveled interstates in the country. Scott County has a much longer section of I-80 in it.
Our efforts to social distance flattening the curve.
My eyeball survey says it is.
Next question. Maybe we could just reiterate this. How many new cases in Scott County today and the total?
Okay, that number in Scott County was 4. 1 in an elderly person, 3 in middle age. That brings the total in Scott County residents to 7. You'll remember that there were 2 positive tests in Scott County that were not counted as Scott County cases.
Do QC hospitals have the staffing, PPE, and equipment they need to handle the demand? Ed, have you been in some of these conversations?
The hospitals report that they have both beds and staff at this time, and that's why social distancing and our efforts toward flattening the curve are important to keep it that way.
Next question. Illinois said it had 673 new cases today, including 7 deaths. That's unclear. Certainly those 7 who died were already ID'd, correct? Nita, do you have anything to give some information to that?
I don't. I received the same information from the state of Illinois as well.
The next question was related to your reference with the eyeball survey. Can you tell us more about what you're observing and what prompts you to think the curve is flattening?
I wasn't speaking specifically about the curve yet because in Scott County, we only have a few cases. I was talking about traffic on the roads, what I've observed about people being out or not.
We did have an additional question regarding,
I'm sorry.
Go ahead, I'm sorry, Nita.
Oh, that's okay. I was just going to say we are certainly still stressing that and promoting that. We have some new social media about why you're social distancing and who you're protecting. And, you know, we're inviting the public to join in that. There is a PDF they can download and take their own picture with that and share it with us. And Brooke was certainly a part of putting that all together. So we are still trying to get those messages out every day to social distance and to wash your hands and cover your cough. All of that's still very, very important.
And we've had a couple of questions regarding the Genesis West campus. Do you have any response to that or suggestions of where information on that could come from?
That question is probably best directed to Genesis. I know that their folk are working very hard to meet the needs of the county and provide the resources necessary to react to COVID-19. Sorry, I got distracted. But that's not a question I can answer directly.
To follow up to what Nita said regarding some social media campaigns that we have out there, we would encourage all of your news agencies, if you're able to share the information we're putting out there. We're trying to increase the understanding of social distancing and how important it is to social distance, not only for yourself, but for those more vulnerable in the community. And so we're encouraging individuals to share why they're social distancing and who they're doing that for. So we would greatly appreciate any shares you could do with us for that in order to increase the messages on that. It looks like we've completed all of the questions that we've received. We again appreciate your assistance with getting the information out. We do anticipate having a call tomorrow at the same time, so we will provide you with that Zoom information. And please know that we'll continue to provide information to you as it comes along. It does look like we have one additional question and then we'll end there. So thank you for your time. What examples you are seeing in which people are not social distancing? Nita, do you have any information for that?
Well, I would just say I haven't been out too much myself except to come to work and go home. So I have been to the grocery store and a couple takeout places, and they look like they are doing a good job. I've seen tape marks on the floor so that people keep a safe distance from each other. So I do think the local businesses are doing a really good job.
Thank you, Nita. Again, thank you everyone for your time, and we'll talk with you again tomorrow.